Have you ever seen blood in your stool? Is it colon cancer or something else? I'm Carly Williams, co-host of the Living Well podcast by Jefferson Health. Finding blood in your stool can be frightening, but it is more common than you might think. Bloody stool can indicate mild perianal disease, which can include conditions like hemorrhoids or fissures that can happen near the anus, or something much more concerning, such as inflammatory bowel disease or even cancer. So when should you worry about blood in your stool? If you notice bright red blood when you have a bowel movement, it's likely coming from a source in your colon or rectum. Gastroenterologist Dr. Lucy Jew says, bright red blood can point to an internal or external hemorrhoid, fissure, inflammatory bowel diseases like ulcerative colitis or Crohn's disease, or even colon cancer. Suppose the blood is dark or has a tar-like consistency. In that case, it's usually an indication that it's coming from the upper intestine, such as the esophagus, stomach, or duodenum, and may be due to an ulcer. Occasionally, slow bleeding from the upper colon may appear this way as well. It also matters where you see the blood. Dr. Jew explains, if you just see blood isolated to the toilet paper when you wipe, it's likely coming from a perianal source like a hemorrhoid or fissure. But when it's mixed in with stool, it may be coming from the rectum or higher in the colon and could be an indication of many other disorders, including inflammatory bowel disease or colon cancer. How do you diagnose the cause of bloody stool? Anytime you notice blood in your stool, it's a good idea to see a healthcare professional, especially if you're also experiencing symptoms like abdominal pain, a change in bowel habits like frequent diarrhea or constipation, or sudden weight loss. Please note, if you experience a large amount of blood coming from the rectum and have symptoms such as lightheadedness, dizziness, chest pain, or shortness of breath, call 911 or head to your local emergency department immediately. Dr. Jew says you don't have to visit a GI specialist right away. Your primary care provider can help you further delineate whether it's something they can diagnose or if you should see a specialist. Diagnosing what's causing blood in your stool may require a physical exam, blood work to check for anemia, or a colonoscopy. Dr. Jew says most people think of a colonoscopy as a colon cancer screening tool. While that's correct, it's also a tool used to diagnose the cause of GI symptoms, and in this case, bleeding. Who is most at risk for colon cancer? According to research, colon cancer is both more common and more deadly in Black patients as well as non-Hispanic white patients. While the overall incidence of colon cancer has been decreasing in adults over 50, attributed to screening, in recent years we've also seen the incidence of the disease increase in younger patients, those under the age of 50. Unfortunately, colon cancer, like most cancers, may develop silently. Screening is intended for individuals who have no symptoms in order to prevent cancer or detect it early before symptoms. And symptoms that should not be ignored, which could indicate cancer aside from bloody stool, can include persistent abdominal pain, unexplained weight loss, pencil-like stool, changes in overall bowel habits, and anemia from chronic blood loss. If you are experiencing blood in your stool, it's important to get checked by your healthcare provider. If the physical examination does not reveal a clear source of bleeding, a colonoscopy is often recommended. This is even the case in those younger than 45, as the rate of colon cancer is increasing greatest in this group. The American Cancer Society and the United States Preventative Services Task Force, USPSTF, recommend colon cancer screening at age 45 or earlier if you have a family history. Colonoscopies are the gold standard for colon cancer screening, as they can discover and remove polyps or abnormal growths before they become cancerous. If you have a history of GI conditions and start to notice a change in your baseline symptoms, it may be a cause for concern, although not definitively colon cancer, and should be discussed with your doctor sooner rather than later. If you're interested in learning more about gastrointestinal health or scheduling an appointment with a gastroenterologist, please visit jeffersonhealth.org/livingwell. For more interviews with Jefferson experts to help support your mental health and physical well-being, listen and subscribe to the Living Well podcast by Jefferson Health on your preferred players, including Apple Podcasts, Spotify, and Podbean.